How can you tell raw inflammation from joint damage? Imagine your joints as busy neighborhoods where different processes are happening. Sometimes, the signs of active trouble are clear, like a fire burning, and other times, the damage left behind is more like the scars of past storms. Rheumatoid arthritis involves both these aspects, but knowing the difference is key to managing the disease effectively. When rheumatoid arthritis is actively flaring, your immune system is attacking the lining of your joints, called the synovium. This causes swelling, warmth, tenderness, and stiffness. You might notice that your joints feel soft or spongy when you press on them, and they often look swollen on both sides of your body, especially in small joints like those in your fingers and toes. Morning stiffness lasting more than half an hour is common, and pain tends to worsen with movement initially, then improve with activity. Sometimes, the skin over the joint may look red, but that's less common. These signs tell you that the disease is active and that the inflammation can often be controlled or reversed with treatment. On the other hand, joint damage is the result of long-term, uncontrolled inflammation that has caused structural changes in the joint. Think of it as the scars left after a storm. Over time, the cartilage that cushions your joints wears away, bones may erode, and deformities can develop. These changes are usually permanent. You might see or feel hard bumps or deformities, like fingers bending abnormally or joints looking misshapen. Movement becomes more difficult, and the joints may feel stiff even after resting. Unlike inflammation, these signs do not come and go. They tend to stay and worsen over time. Imaging tests like X-rays can reveal joint space narrowing, bone erosions, or cysts, confirming that damage has occurred. Distinguishing between inflammation and damage involves careful examination and imaging. During a physical exam, inflamed joints feel soft, warm, tender, and swollen. Damaged joints feel hard, may be deformed, and are often less tender. Symptoms of active inflammation tend to fluctuate, with periods of worsening and improvement, especially after rest or activity. Damage, however, causes persistent stiffness and loss of function that does not improve with movement. Imaging can help differentiate early inflammation, which might show swelling of soft tissues, from damage, which reveals erosions and joint space loss. Treatment response also helps tell the difference. Active inflammation often responds well to anti-inflammatory medications and disease-modifying drugs, which aim to control the immune attack. Once damage has occurred, it cannot be reversed, but early and effective control of inflammation can prevent or slow down further damage. That's why early diagnosis and treatment are so important in rheumatoid arthritis. They help preserve joint structure and function for the long term. In summary, if your joints are swollen, tender, warm, and fluctuate in symptoms, you're likely experiencing inflammation. If your joints are stiff, deformed, and show permanent changes on imaging, you're dealing with damage. Recognizing these signs helps healthcare providers tailor treatment plans to protect your joints and maintain your quality of life. Always consult your doctor for personalized advice, as each case of rheumatoid arthritis can be different.